What's up, guy? In this lecture, we are going to discuss rheumatic fever. We will see the clinical diagnosis of the rheumatic fever. So, without wasting time, let's get started. First of all, we will see the main cause of the rheumatic fever, and that is the group A streptococcal infection, and that bacteria specifically is the Streptococcus pyogenes. So, it causes the throat infections like pharyngitis, and after the recovery the antibodies start producing in the patient, and these antibodies ultimately after the infection will attack on the different organs of your body, and you will see the different manifestations that we will see in this lecture. So important thing, rheumatic fever, you will see after the throat infection. That is the important thing. So it is a post infection case. Okay. And it is autoimmune complications. So after the throat infections, antibodies start producing in the body of the patient, and these antibodies will attack on the different organs. So this clinical diagnosis will be made with the help of the Jones criteria that we will see. So first thing in the diagnosis, you have to take history from the patient of the recent strep infection, and then we will move towards the two major criteria of Jones, and we can also take the one major criteria and the two minor criteria that we will see. So any important clinical points regarding its diagnosis. So it is common in the children 5 to 15 years of age. That is again the important point in the diagnosis of the rheumatic fever. And second important point which you have to remember, after 2 to 4 weeks of untreated strep throat, that after that you can see this complication, and that will be the rheumatic fever. So what type of clinical manifestations you will see during this uh, criteria? So we have categorized into major and the minor. That first of all we will see the major criteria. So in the major criteria you will see the 5 manifestations. First is the carditis, inflammations of the heart, and in that case you will see the tachycardia. This is the important thing regarding the inflammations of the heart. You can also see the murmurs, abnormal heart sound you can listen, and most specifically what type of murmur you will see in that case, that will be the mitral regurgitation. Why this murmur happens? Due to the backflow of the blood from the left ventricle to the left atria, because the mitral valve is present in the left side of your heart, and whenever you see the backflow of the blood from the left ventricle to the left atria, you will see the mitral regurgitation, and you can listen its sound in the form of murmurs. Okay. Next, you can also see the cardiomegaly, increase in the heart size, and it can go towards the heart failure as well. So this is the first major criteria, that will be the carditis. Second thing, migratory polyarthritis, in which you will see the joints pain and the swelling. But this joint pain can migrate from one joint to another. So what important joints will be affected by this? This will be the knee, ankles, elbow, and the wrist, and this pain can migrate between these joints. So that is the migratory polyarthritis. That is the second major criteria. Third is the sedim's chorea. Sedim's chorea, in which you will see the involuntary movement, that is a neurological disorders, that is sedim's chorea. And in that case you can also see the emotional instability and the muscle weakness. So you can see the involuntary jerky movements of the muscles in the patients. So this is the third major criteria. And you can also see the erythema marginatum. In that case you will see the non-itchy pink rash will be seen. There will be the no itching at the rash, and ring shape with clear center will be seen in the erythema marginatum. So this is the third major criteria. And fifth one will be the subcutaneous nodules. In that case, you will see the small painless nodule specifically on the tendons, and the bony prominence will be seen. So these are the five major criteria uh, of the rheumatic fever. And minor criteria will be the fever. You can also see the arthralgia. That can also be lie in the major one. Increase in the ESR and the CRP. And you can also see the PR interval prolongation. So on the ECG, you will see the PQRST, two basically three segment PQRS complex and the T. So you in that case, you will see the prolonged PR segments on the ECG. So this will lie in the minor criteria. So these are the five major criteria and the four minor criteria. So we have to see, first is the recent strep infection. Then we can take the any two major criteria from carditis, migratory periarthritis, sedinum chorea, erythema marginatum, and the subcutaneous nodule. So you have to check only two major criteria, okay, in the diagnosis of the rheumatic fever, or you can take one major and the two minor criteria in that case for the diagnosis of the rheumatic fever. So this is how we will move towards the rheumatic fever. And but the important thing, how we will check the recent strep infection, and how can we know that the patient is already having strep infection in the past. So you have to take history and reports in which you will see the positive throat culture. Okay, you can also see the rapid antigen test, and you can also see the ASO titer will be raised in that case, and anti-DNase B will also be raised in that case. So these are the antibodies that cause during the strep infection, streptococcus pyogenes bacteria specifically. So if we summarize what we have to see in the diagnosis of the rheumatic fever, so in the history, you will take the sore throat history, that is pharyngitis, and it can be 2 to 3 weeks ago sore throat infection. And you can also take the history of fever, joint pain, and abnormal movement that is specifically related to the sedinum chorea. And you can also go towards the physical examination. You can go towards the heart murmurs by using the stethoscope, and you can also uh, do in physical examination like joint swelling will also be seen in that case, skin rash or nodules, and chorea. So these are the different things that you will check during the physical examination. And in the lab, you will see the raise in the ESR and the CRP, and ASO titer will be raised. So as we have already discussed, after the throat infection, antibodies start producing. And specifically, what type of antibodies? ASO, anti-streptolysin O antibodies will start increasing in the body of the patient, and these antibodies will affect the different organs like the hearts, like the joints, and you can also go towards the brain. And in the imaging, you can go towards the ECG. In the ECG, what will you see? PR prolongation, and echocardiography, in you will see the heart valve damage. So that's why you can see the mitral regurgitation due to the damage of the heart valve, specifically mitral valve. So this is the things that we have to consider it during the diagnosis of the rheumatic fever. If you still have any question, you may ask in the comment section. Thank you so much.